Hello, my name is Peter Lawrence, and I'm pleased to introduce the December issue of the Journal of Vascular Surgery, and to highlight 4 outstanding papers which are freely available for the next 2 months. Our editor's choice CME article is Surgical Volume and Established Hospital Perioperative Mortality Rate Together Predict Superior Outcomes After Open Abdominal Aortic Aneurysm Repair by Joshua Geiger and co-authors. The Society for Vascular Surgery has published hospital volume guidelines for elective open abdominal aortic aneurysm repair, and these were published in 2018. They recommended that elective open AAA repair be performed at centers with an annual volume of more than 10 cases and a perioperative mortality of less than 5%. As well as a yearly surgeon volume of greater than 7. The authors used a New York State-wide planning and research cooperative system database to determine the impact of the SVS guidelines on postoperative mortality and complications. 7,594 elective open AAA repairs were performed by 542 surgeons in 137 hospitals during the 12-year study period, with a 1-year and 30-day mortality rate of 9.2% and 3.5% for centers within the SVS guidelines, and 13.6% and 6.9% for those outside the guidelines, in other words, significantly higher. Centers that met the SVS AAA volume guidelines had improved 1-year and 30-day all-cause survival. A surgeon with an annual volume of more than 7 open aortic operations should, in their opinion, perform elective open repairs at centers with a documented perioperative mortality of less than 5%. The next article, Intraoperative Blood Pressure Lability, carries a higher risk of headache after carotid endarterectomy by Lee and co-authors. Cerebral hyperperfusion is potentially a devastating complication following carotid endarterectomy, but the symptoms range from just a unilateral headache to intracranial hemorrhage. The authors examined intraoperative and postoperative blood pressure variation as a risk factor for headache and hyperperfusion. 735 patients had either eversion carotid endarterectomy, which was performed in 59%, or patch angioplasty of the carotid artery, which was performed in 42%. The incidence of headache was 19%. 1.5% had no relief with analgesics and blood pressure control. And head CT scans performed in 18 patients revealed 1 ipsilateral intracranial hemorrhage. Intraoperative mean arterial pressure had the highest risk for headache, followed by intraoperative mean arterial pressure lability, and this is the conclusions of the authors. Maintain a low but consistent blood pressure to avoid headache. The next article by Alicia and co-authors is Early Outcomes of TBranch off-the-shelf multi-branch stent graft in urgent and emergent repair of thoracoabdominal aneurysm. 100 patients had elective, urgent, or emergent repairs using the TBranch device. The targeted vessels, which were visceral vessels, were cannulated in 93%, 94%, and 98% respectively, with an overall technical success of the procedures based on the degree of urgency of 97, 98, and 95%. The intensive care unit stay was shorter in the elective group than it was in the urgent or emergent groups. The 30-day mortality was 7% in the elective group, 16% in the urgent group, and 24% in the emergent group. Acute kidney injury was lower in the elective group at 7%, while it was 22% in the urgent group and 38% in the emergent group. And spinal cord ischemia was the lowest in the elective group. The cumulative survival was 95%, 87%, and 87% at 6, 12, and 24 months respectively, and freedom from reintervention was 92, 86, and 77% at 6, 12, and 24 months. The authors concluded that the technical success of thoracoabdominal aortic aneurysm repair using a TBranch stent graft was not affected by urgent or emergent presentation, but there was a worse peri-procedural morbidity and mortality when procedures were performed on an urgent or emergent basis. The final article by Yap and contributors is Predictors of Outcome in Diabetic Patients Undergoing Intraoperative Endovascular Revascularization for Chronic Limb-Threatening Ischemia. This study evaluated the impact of perioperative glucose control on long-term outcomes, as well as examining several other factors. 437 infrapopliteal target vessels were successfully treated in 203 patients with an endovascular approach. The amputation-free survival was 74% and 63%. The primary patency was 61 and 50%. The assisted primary patency was 69 and 57%, and the secondary patency was 71 and 59% at 1 and 2 years respectively. A high perioperative blood glucose was an independent predictor of restenosis. Dual antiplatelet therapy was a predictor of improved amputation-free survival and freedom from major adverse limb events. And a low baseline glomerular infiltration rate was significantly associated with a better amputation-free survival. Thank you for watching, and please follow us on social media. Remember to like, comment, and share. We hope you enjoy these 4 highlighted papers and the other excellent papers in this month's Journal of Vascular Surgery. Remember that these articles are free to read until the end of August. And thank you for your attention.